Hey guys, Dr. Maxwell and Dr. Yap here. We're going to take you through mobilization for your mid-back, specifically for your thoracic spine and rib cage, which can be collectively called your thorax. Now, some people will do this kind of exercise on one of those big foam rollers, and it's not our preference, to be honest. And the reason is because our thoracic spine, our rib cage, does not have that much extension. So when we start mobilizing over those foam rollers, most of the movement is going to happen in the lower back and or the neck. So for us, we want to achieve better segmental uprighting or segmental extension through the thorax. And we're not so concerned with global extension if it's not facilitating a better quality of movement. So for that, we need that segmental uprighting, that segmental extension. So we like to use what we call a mat mobilization. And we take a yoga mat, we tightly roll it up. So get that yoga mat on the floor and tightly roll it up, and then lay it on the ground. And you're going to lie over this thing with your mid-back and breathe into it. So I'm going to walk you through that. So when you set this up, you're going to grab onto your head and you're going to slowly lie yourself down. And so you sit basically the middle of your shoulder blades across this yoga mat. And you're a little bit crooked, so I'm going to change that. That's good. And then heels will be nice and tight to the bum, because they're going to use the heels to push off a little bit. So drop your head so it's kind of in line with the rest of your back, and then lift your bum just a little bit. And then use your hands to pull your head, like you're tractioning your head over the mat. And when you do that, you will kind of slide down, not inching yourself, but sliding down. You'll feel like that creates a little bit of a pull on your skin in your mid-back. And you'll finish kind of on the lower edge of your shoulder blades. Once you get into that position, you're going to pull the back of the head down to the floor by tucking your chin down. So you're kind of drawing the chin straight back to the floor. Once you get the head to the ground, you can slowly release your fingers and extend them out to the side. And once you get to this position, just imagine that you're fixed to the floor. So there's Velcro that's holding you down to the yoga mat, that's holding your head and shoulders down to the ground. And then you elongate the tailbone towards the back of the knees, lengthening your spine away from that yoga mat. And then very slowly lengthen away as you lower your pelvis down to the ground. Once you get your pelvis to the ground, you can let one leg drop down and the other, and then just relax your legs. Okay, so you'll know if you're in the right position or you have the right thickness of the mat if you see this kind of elongation through the back of the neck with the chin very so slightly tucked down. And to show you what would be not so good would be here. If you feel like your head is tilting in this direction and you see this kind of shortening of this line in the back of his neck and the lengthening in the line through the front of his neck, that's going to put more stress on the neck than we would like. And it's also not going to well localize the mobilization to the mid-back. So again, you think elongate the back of your neck and draw the chin down to the floor until the back of your head rests nicely on the floor. And for the same reason of us not wanting this short line or compression in the back of the neck, we also don't want that compression or short line to exist in the lower back. And that is why we elongate the tailbone to prevent this stretch from merely resting into that lower back, which is much more generally flexible in an extension pattern, but the mid-back is an area that's very commonly stiff in that direction. So we have to make an intentional effort to ensure that the mobilization is localized in this space on the mat. So lengthen, draw the chin down, lengthen, let the pelvis slowly lower down, and then let the legs go. Now the arms, I like to have this gentle sense of elongation. So I want broad shoulders. And so we think of kind of widening or elongating from the center of your body out through the fingertips, with your fingers and thumbs gently resting on the floor and your shoulder blades kind of sitting back over the mat. So think the shoulder blades are sitting back and gently widening. Feels good. Dr. Yap says that feels good, and he's right. It does feel really good. Okay, and that's kind of where you want to stay when you're doing this. Now, once you find that stable connection to the floor, it allows you to be in a position to use the breath to mobilize your rib cage. So your mid-back, your thoracic spine, is just one component of uprighting or movement in your mid-back. It really is the entire thorax, the combination of the thoracic spine, all of the ribs, the fascia and connective tissue in between the ribs, but also in the mediastinum, which is like the center of your chest. This is all part of what can become stiff if you're constantly locked down in this space. So when we become fixed to the floor like this, and we start to breathe into this position, we lengthen our breath, which allows us to open the chest over these fixed points to create this expansion or mobilization with our breath. So generally speaking, I try to get people into what I call a long and relaxed breath. And that could be 3 seconds in, 6 seconds out. For some, I like to get people closer to 4 seconds, 8 seconds, or 5 seconds, 10 seconds. So 5 seconds in, 10 seconds out. So Dr. Yap, I want you to go ahead and slowly build a full inhalation on 5 seconds. 1, 2, 3, 4, 5. And then let it go. Exhale all the way out. Relax into your exhale. Let that chest drop. There you go. That's better. Keep on going. 5, 4, 3, 2, 1. And then inhale. You got ahead of me, didn't you? It's okay. Keep on going. Exhale. Let it go all the way out. Finish your exhale. Give me 5 more seconds. 4, 3, 2, 1. And then inhale on 5. 1, 2, 3, 4. Expand all the way up through that rib cage. 5. And then let it go. Relax into the air, exhalation, and let the chest drop, sink into the floor. Give me 5 more seconds. 4, 3, 2, 1. Very slowly breathe in. Keep on coming. Expand that breath all the way up through the chest. And then exhale all the way out. Let it go. Long exhale. 5, 4, 3, 2, 1. Good. Dr. Yap, continue with that tempo for me. I'm going to walk you guys through this a little bit more. When you breathe, you're going to start this inhale with a gradual build. And that gradual build is going to start somewhere low in your belly, and it's going to expand through the chest in all directions. So at the end of his inhale, it's going to expand all the way from the belly, all the way up through the chest, so that he is getting wider and deeper through his rib cage. So if you imagine that his thoracic spine, his mid-back is fixed to that yoga mat, which it should be, when he breathes in, he should be getting deeper from the yoga mat to my hand. He's expanding in both directions, down into the mat, but also up to my chest. If I put my hands here, I should also feel, as he breathes in, that he gets wider, that he opens up and out through his rib cage. Long breath out, let it go. Now, on the exhale, when we say breathe out on 6 seconds or breathe out on 8 seconds, a lot of people will think that they have to slow their breath down, and that's not what we mean. What we mean is that we want to lengthen our exhale, but that lengthen exhale is more on the end range of your exhale. So when you come out of that full inhalation, you want to use the elastic energy of your chest, which you've built up through this full breath, and you're just going to let it go. Just relax and let it go. Yeah, and just sink into the floor. And then you lengthen through the end of your exhale until you feel like there's no air to be exhaled out anymore. And you pause. And then you breathe in. So think of this as a wave where you slowly build into a full breath in, and then you hit the crescent of that inhale and you let it go. You fall down the other side. As you get down towards the end of your exhale, that elastic energy is gone. Most of your air or all of it has been exhaled. And there's going to be this brief pause at the bottom of the valley, a moment in which you are neither breathing in or out. And it turns out that that lengthened exhale and that pause at the end of the exhale is really good for your parasympathetic nervous system. Nice. It's like there's a dead space at the end of your exhale in which you have an opportunity to feel the relaxation and the heaviness in your body. Sink into that exhale all the way out. And then just pause a moment. And then breathe in. Nice slow build. Fill it all the way up. Keep on coming. 4, 3, 2, 1. Exhale. Let it go. Relax your chest. Sink into it. Brief pause at the end of your exhale. Nice slow breath in. Build it all the way up. Sometimes when we work into a big inhale, we start to put tension up in our chest or tension up in our shoulders. And that's what I was cueing Dr. Yap on there, is when he fills in that breath, I shouldn't see him tighten up here. So I was cueing him to stay heavy over that mat, to keep his shoulders kind of sinking down to the floor and nice and wide. And then as he breathes in, he expands the chest, but he doesn't tighten up through his neck and shoulders. That space stays heavy and relaxed. I generally have people perform somewhere between 10 to 15 breaths. I usually give people the option. So let's say, hey, do somewhere between 10 to 15 breaths. We'll find a rhythm of the breath that's comfortable for the patient. So for some people, that's 3 seconds in, 6 seconds out, and other people who have very high cardiorespiratory capacity and very healthy nervous system in the context that they don't hyperventilate and they have good balance between that sympathetic and parasympathetic nervous systems. Those people usually can lengthen that breath out, especially the exhale more so. So start where you're comfortable, and then as you get more comfortable and practice this, you can start to elongate that breath a little bit further. So that's the T-spine mobilization with the mat, or T-spine mat mob as we call it. To get out of it, by the way, you're going to feel, especially if you have stiffness in the area, it's going to feel a little bit achy for a moment when you first get out of it. So I always get people to get out in a very specific way, and that is to not sit up out of it, rather to grab your head and then just roll out of it, and then you can get up from your side. Anyways, have fun with that one, and enjoy your time relaxing into this exercise. This is a great one to do at the end of a workout. It's a great one to do at the end of your day. It's really going to help bring your nervous system down, but it's also going to open up that chest and that rib cage. So have fun, and hope you guys have a great day.